Today, we're going to step inside a fascinating clinical study to see exactly how psychiatrists are using psilocybin-assisted therapy. We're going to get a look at the whole process, how they're taking a powerful psychedelic and carefully turning it into a potential new treatment for severe depression.
So this is really the central question for the clinicians, isn't it? Giving someone psilocybin isn't like handing them a pill for a headache. It's about building a safe, supportive container for what can be an incredibly intense psychological experience. The psychiatrist's role here, it's really less like a doctor and much more like a guide.
And the mission here, well, it's to help the people for whom nothing else has worked. We're talking about treatment-resistant depression. Clinically, that means someone whose major depression hasn't gotten better after trying at least 2 different standard antidepressant medications.
And you really have to grasp the weight of this. This is not a first-line treatment for a mild case of the blues. The patients in these trials are often struggling with a crushing condition they've lived with for years, sometimes even decades. The stakes are just incredibly high, and that's exactly why the entire clinical process is so rigorous.
Okay, so now we get to what is arguably the most critical part of this entire therapy, the preparation. The clinical teams behind these studies all say the same thing. The work you do before the session is just as important as the session itself. You don't just walk in, pop a capsule, and hope for the best. You prepare for the journey.
And this prep work is a whole process, really. It starts with incredibly rigorous screening to make sure the patient is safe. Then comes a really dedicated period of just building trust and rapport with the clinical guides. And finally, they even do a sort of gentle simulation of the experience, just to help reduce any anxiety about the unknown.
Safety is absolutely everything, which is why this screening is so strict. To even be considered, you couldn't have any personal history of a psychotic disorder, or even have an immediate family member with one. Any history of mania, serious suicide attempts, or current drug or alcohol dependence, those were also immediate disqualifiers. It's all about minimizing risk.
And this isn't some quick 15-minute consultation. We're talking about multiple hours. In one study, it was almost 8 hours on average that the patient spends with the 2 psychiatrists who will be their guides. They go through the person's life story, the history of their depression, and they talk about exactly what to expect, both in their mind and in their body, during the actual session.
So after all of that intensive preparation, dosing day arrives. And the main goal on this day is to create what they call a safe harbor, a therapeutic environment that is designed from the ground up to support a deep, inward-focused experience.
You might be picturing a sterile white hospital room, but it is the complete opposite. The studies describe rooms that look more like a comfortable, cozy living room. There's a couch, low lighting, and they play a carefully curated music program through headphones. Patients also wear an eye mask. Every single one of these elements is designed to just cut out external distractions and help the person go inward. The treatment itself actually happens in 2 stages, spaced 1 week apart. The very first session is a low dose, about 10 milligrams. This really just serves as a safety check, and it helps the patient get familiar with the feeling of the substance, but in a much more gentle way. Then, 1 week later, they come back for the main event, the therapeutic session with a higher 25 milligram dose. Once that dose is administered, the experience tends to follow a pretty predictable path over about 6 hours. The effects usually start to kick in within the first hour. They'll peak somewhere between 90 minutes and 3 hours in, and then they'll gently taper off. And all the while, the clinical team is right there, monitoring vital signs like blood pressure and heart rate at regular intervals.
So what are the guides actually doing during these 6 hours? Well, surprisingly little, and that's by design. Their role is explicitly non-directive. They aren't analyzing things, they're not asking a bunch of questions. They just sit quietly, one on each side of the patient, providing this reassuring, grounded presence. If the patient needs support, they offer it, often with this simple mantra they use in the studies: trust, let go, and be open. But of course, a journey like this isn't always going to be smooth sailing. The clinical protocol is designed with a deep understanding that some psychological turbulence can, and often does, come up. So let's look at how the team prepares for and manages those challenging moments.
When a patient starts to feel anxiety or fear, the first and most powerful tool they reach for isn't a drug, it's that human connection. That deep foundation of trust they spend hours building becomes an anchor in the storm. Often, a reassuring hand on the shoulder or a calm voice from a trusted guide is all it takes to help someone navigate a difficult patch.
And the studies were really transparent about adverse events. As you can see, the most common ones were pretty much what you'd expect. A bit of temporary anxiety as the effects were coming on, that was noted in almost everybody. Some confusion during the peak, a little bit of mild nausea, or maybe a headache the next day were also reported.
The key thing is, these were all temporary, and they all resolved on their own.
And this right here really highlights how successful the safety protocol was. Across these studies, there were no serious adverse events caused by the psilocybin itself. The teams had tranquilizing medications on standby just in case, but they never actually needed to use them. That psychological support was enough.
So, after going through the whole journey, what was the actual impact? Did it work? Now we get to look at the clinical data that has made this whole field such a compelling new frontier in psychiatry. Before we look at the results, I want you to remember this number: 17.8 years. That was the average amount of time patients in one of the key studies had been living with depression. We are talking about an illness that had defined most of their adult lives.
Just 1 week after that final session, the results were, well, they were remarkable. 67%, 2/3 of these patients with severe, long-term, treatment-resistant depression were in remission. For a group that hasn't responded to anything else, that is just a stunning outcome. This chart really says it all. Each one of these lines is an individual person's story, told through data. You can see almost everyone starts way up in the severe depression range at the beginning, and then after the treatment, look at that dramatic cliff dive. Many of them plummet straight into the no depression zone, and what's really important is that they stay there for months. And the benefits weren't just about depression scores. The studies also found big, lasting reductions in anxiety and anhedonia. That's the awful inability to feel pleasure, which is such a core part of depression. So patients weren't just less sad, they were actually better able to experience joy again.
So what does this all mean? What does this research point us? It really suggests we could be looking at a whole new direction, a new therapeutic compass for treating some of our most stubborn mental health conditions.
So let's just recap the key takeaways. First, psilocybin works through a completely different mechanism than our standard antidepressants. Second, that psychological support isn't just a nice add-on. It is a critical part of the treatment's safety and effectiveness. And, it's really important to remember, we're still in the early days. Larger, more rigorous trials are definitely needed to confirm these amazing initial findings.
Which leaves us with a really fascinating question to think about. The model we've just explored isn't just about a new drug. It's a whole new paradigm that combines pharmacology with deep psychological support. So, could a treatment that addresses the mind, one that's kicked off by a molecule but really guided by human connection, be the future of mental health care?